Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. This podcast is for informational purposes only and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organizations this podcast is affiliated with. We will discuss opioid use, opioid treatment, and physical and psychological trauma, which may be triggering for some listeners. Listener discretion is advised. Today on Someone You Know, we are speaking with Patrick and Ramon about the intersection of mental health and substance use disorder. Both Patrick and Ramon are currently in long-term active recovery and believe in a holistic, individual approach to treating substance use disorder. This episode explores the impact of having a dual diagnosis and reducing the effect of stigma in mental health and addiction. I'm your host, Heather Major, and this is Someone You Know. Well, I want to thank you both for being here today. We're going to be talking about something that I think needs a little more attention, and hopefully you would agree, the intersection of mental health and substance use disorder. But first, before we get into that, let us have you introduce yourselves. Patrick?
Sure. My name is Patrick Mullen. I think most relevant to this conversation today, that means I'm a person in long-term recovery. And kind of a cool thing with that is that in 9 days, we will celebrate 5 years of a continuous recovery. I'm also, I hold a master's degree in mental health counseling, so I'm a counselor. Currently for Addiction Treatment Center. I'm also a student, so I'm still in a doctoral program for clinical psychology, studying psychology and mental health and addiction, kind of en route to becoming a clinical psychologist.
Hi, my name is Ramon Cruz, and I also am in recovery from co-occurring issues, mental health challenges, and substance use disorder. And I'm a certified peer specialist, but today I'm glad to say my new title is a behavioral health specialist for the city of Philadelphia.
Great. Well, welcome to you both. Patrick, let's start with you. I think it would be great for our listeners to hear what your connection is to the opioid epidemic and a little bit about your journey.
So my connection to the opioid epidemic is it's both very personal and also now very professional. My experience with the epidemic was my own. As I stated, I'm in recovery from substance use disorder, which includes opioid use, also includes a lot of the co-occurring issues that we're going to be talking about today. So I experienced the opioid epidemic firsthand, and in my experiences in recovery, receiving treatment, and then in recovery, I kind of got to a place where I made a career choice to go back to school and study psychology, with kind of the aspiration of becoming a counselor, becoming a mental health therapist, someone that can help others going through, what I went through in a lot of ways. And now, I kind of continued down that academic road a bit and am now in a doctoral program studying clinical psychology. And my ultimate goal with that is to get to a place as a doctor of psychology to implement some real change at a broader kind of public level. So now, as a person in long-term recovery, I'm afforded the opportunity to be an advocate for others in the midst of this opioid epidemic currently. And I'm privileged enough to be a counselor and work with others going through their recovery process. And one day my ultimate goal is to be in a place to change policy, to be at the table and make decisions for us, for all of us in our recovery community that really need more resources and need more help than we're currently kind of getting.
And if I could ask a few follow-up questions. In your journey to recovery, when you were experiencing active addiction, at what moment, or was there a moment that really prompted you to seek treatment?
Yeah, so that's an interesting question for me, actually, because I was more or less pleaded with to go to treatment at first. I didn't have that initial kind of surrender or kind of epiphany that I need help. It was really brought to my attention by a loving and supportive family who really urged me strongly to go to treatment, and I did, with their help and support. And my motivation to change, my motivation for recovery came after I made that first step to get to treatment. And it wasn't until I was in treatment and thereafter treatment, went through my own process of figuring out and, wanting for myself a better life, a better way of life, and coming to that decision, really coming to that awareness of my problems on my own, took some time. It wasn't an instant thing or like this epiphany type of moment. It was a process, as I think it is for a lot of people.
Ramon, what's your journey? What has your experience been?
So my story is basically twofold, and I say that because I started to sell drugs, sell opiates. For many years I did, and it wasn't, and it brought me a lot of in and out of incarcerations for about 20 to 25 years. But it was during one of my incarcerations that I received news that my father had passed away. And it was in prison that I, dealing with depression, anger, resentment, which was the core of my addiction, that led me to the use in prison. And I started using opiates in prison. And in saying that, that's where my journey took me. My journey, basically, I gave up. I gave up. I didn't want to feel the things that I was feeling. And opiates took care of that for many years. And I came home and discharged from prison with a full-blown substance use disorder, which took me to many, many dark places. Living in abandonments, living under bridges, took me to places that I never thought, because I came from a very good family, good morals and values, spiritual values. So these are my nevers that I never thought would be, and it took me to my nevers. Co-occurring issues was a big part of my life, and it was until I started to see that where it was taking me. So as I said, I started my opiate addiction in prison, and I ended it in prison. That was the turn where I turned to working on the core of my addiction in prison and getting treatment and learning to deal with the void that I had and accepting my father's death, and learning that, he wanted better.
Well, trust universally is critical to building relationships, but trust, particularly in your professions, I think, is really important. It's going to take some time. You got to break down stigma and a lot of different barriers, but you can build the trust. You can have the trust. You come in having lived experience, being a part of the community. Patrick, what about you in terms of trust and trust with, the work that you do and the populations that you serve?
Yeah, it's such a important piece is trust, but also that therapeutic alliance. So, as a counselor, I work with a number of individuals that don't share my culture, may not share my race, that might not share might not share some of my values. We may be different on a lot of different levels. So how do you then instill trust, or how do you then develop a therapeutic alliance and rapport with an individual that may look different than you, and there's not an easy answer to that. But what I've found and discovered is that, when you connect to a person on a human level, when you can, also share a little bit of your lived experience, a little bit of self-disclosure can go a long way if you're strategic about it, if you're smart about it as a counselor. For me, in my experience as a counselor, it's letting them know that I care. That I care about their life, I care about their goals, I care about what they care about, and I'm going to do my best to work with them and help them get to their goals. And that I'm invested. I'm going to walk with you on your journey, on your recovery journey, for a few months here. I'm going to walk with you side by side and be of service as best as I can. And for a lot of people, they've never had that. And I've had a lot of clients that never really had someone that cared that much about them, or had, like Ramon was talking about, went through some serious trauma. Never had someone take the time to process it, to talk through it. So connecting with someone on a human level, developing that therapeutic relationship, even the research shows that that's the most important thing, even in terms of outcomes, is, can you and your counselor, trust each other, respect each other, and have that alliance there, and care and listen, and be present for them, and that's what I try to do.
Ramon, it sounds like you're doing the same thing, but you're doing it in a very boots on the ground, direct service way within the greater Kensington community. Would you agree, though, with caring? You have to know. It has to be genuine. It has to be authentic. You have to really care.
Yes, and I say that because, people with substance use disorder, especially in the Kensington area, can really see through you. And I remember when I had my substance use disorder, you can tell a person that's genuine. You can tell a person that really wants to help you. So yeah, when I go out in the community, and that's also the community that I live in, so they know me for a long time. So they're able to trust me. They're able to know. But I also, with compassion, empathy, I know I can sit there, and when they talk about what they're going through, I know what they're going through. I've been there, and they know that I've been there. So anything that I can tell them, they know it's genuine, and that's where you build that trust. I could say in my community today, trust is first. Before anyone would ever think about even engaging or an encounter with you, they want to be able to know they're going to trust you. Yeah, because they know that they're ready to put their life in your hands, and you're going to be empathetic about it.
One of the things I love about this conversation is that this goes beyond sort of the statistics and what you'll read in terms of research. This is you're talking about real people. You're talking about real relationships. You're talking about real change, and trust is a big part of that change. We want to get a little bit more into dual diagnosis or co-occurring conditions for mental health and substance use disorders. I read a SAMHSA report from 2014 that sort of provided a little bit of a higher level picture of the millions of people who are experiencing mental health issues, which, as far as I understand, is greater than the number of people who are experiencing substance use disorders. However, there's an overlap between the two of about 8 million people, and I imagine that's probably an underrepresented number. Could be. Why do you think it's important to understand that connection, that overlap between mental health services or mental health conditions and substance use disorder?
So, co-occurring issues is huge. Again, those are the things, the factors that led me into opioid use disorder, and it was just dealing with the hurt, the pain, the depression. And not everybody has a substance use disorder. They're dealing with a lot of mental health challenges. And they don't want to feel that pain. They want to cover that. And it could be from childhood. It could be, and escaping the pain has brought them to substance use disorder. So I always look at the person in a whole approach, and a lot of people that go into treatment, they get detox, they get treatment, and not work on that core of that addiction. And people want to understand why the person comes back out and continues to use. It's because they haven't dealt with the core of their addiction. And when you start dealing with the core of your addiction, you start learning to heal.
Patrick, would you agree?
Yeah. I mean, wholeheartedly. Yeah. I mean, everything Ramon said is just so true, and it's the stuff that we've seen in the people we work with, that we've seen in ourselves. There's just such a relationship between mental health and substance use disorder. I think it's hard to tease them apart. I think in so many ways, we need to start looking at them as one, as one kind of relationship, that if we neglect to treat, the mental health aspects of someone that presents to treatment with a substance use disorder, we're not being comprehensive enough. We're not, like Ramon said, a lot of people will go out and they'll relapse, they'll have missteps, because a lot of what really brought them to treatment was unaddressed, never really got even talked about, or they never saw a physician for potential medication. They never saw a mental health therapist for CBT, or any other of these evidence-based things that we have for mental health. Sometimes we just don't utilize for substance use disorder because we separate the two, and I just don't think they're that separate of issues.
The person-centered approach, I believe everybody should go into treatment in a way what fits that person. When you going into detox and treatment, those are great starts, but you have to continue to sustain recovery. It's a lifelong process. I say always this: recovery is a process, it's not an event. We live it daily. Every day we have to deal with situation. Life's on life terms. So you have to have that approach of, okay, we'll take care of the substance use disorder, but then how can we sustain this recovery? What else needs to be worked? Cognitive behavioral therapy was worked for me in prison. Changing the way I think, changing my behaviors, because many times I went into treatment and came out, yes, I felt I was clean, but my behaviors still were the same. And my behaviors took me back to square one and using again. So I believe you have to have that comprehensive approach where you have to deal with everything that has taken you to that substance use disorder. So whatever it is, if it's your behaviors, the way you think, now you have to start thinking a different way. Today, I'm not that person. So today, my train of thought is a lot different. It's not about survival. When I was in substance use disorder and in Kensington, my train of thought was surviving. Today, it's about finding peace in my life, enjoying life, because that's huge today. I wake up in the morning and I thank God, I'm grateful that I have another day. And I enjoy life. I laugh. People that know me know, they say that I'm a prankster, I'm a jokester. But that's how I deal with life today. I don't deal with picking up a drug. I really try to have laughter in my life today because it brings me joy.
There's a lot to be said for laughter. It does bring us joy. And Patrick, from a clinical perspective, what are your thoughts on treatment options and things that people should know? Well, if they're thinking about seeking help for themselves or seeking help for a family member, cognitive-based therapies. What are some of the options out there for folks?
Yeah, and that's the thing, is that there are a lot of options, and people aren't always so aware of those options, which can be the problem. But like Ramon said, one size does not fit all. You're absolutely right, and treatment needs to be individualized, and our approach to our recovery needs to be individualized and based on us and our values, what we care about, what different conditions, mental health problems, what substances we were abusing. It's all variable, and therefore our recovery is going to be a little variable and going to be a little different. One size does not fit all, and also one treatment approach is probably not sufficient either. I think a more comprehensive approach that includes support groups and your traditional substance use disorder treatment, on top of, something like cognitive behavioral therapy or dialectical behavioral therapy, problem-solving therapy. The list goes on. There's many different types of treatments out there that have been proven effective, some more than others, but based on you and your self-assessment and the problems you have, what mental health conditions you're dealing with, there needs to be a catered approach. There needs to be an individualized, kind of route you go about your recovery. And like Ramon said, it's lifelong. And that can seem daunting, but, on the other hand, it can be also pretty exciting that you have like the rest of your life to kind of get better and improve. And the other cool part about, maybe I should say exciting part about dealing with a co-occurring disorder is that there is a type of synergy there, so that when your mental health improves, your substance use disorder usually kind of comes along for the ride and improves also, and vice versa. Once you stop using drugs, your mental health symptoms, different conditions you're dealing with, will also typically improve too. Does that mean that that's enough? No. Then you have to still kind of supplement it with different ways, different things that work for you. And the other thing I'll add is that, there may be something you try that doesn't work for you, or that you don't feel like you're really jiving with the therapist. Then we need to be adaptive and move on and maybe try something else too. Ramon mentioned his experience with cognitive behavioral therapy. I've had my own, and I love CBT, and now I practice it as a clinician. So there's a lot of different approaches. I think we just have to find the one or ones that work for us individually.
And can you both give a little advice about how people would go about seeking out those types of help? Like, where would they start? What would they do?
Well, it all starts once you get into treatment and you get in touch with a therapist. I think the therapist and you should come together in your treatment plan. I really believe you're a huge part. I think you're 70% of your treatment plan, and the therapist is there to guide you and lead you in that direction, and maybe kind of tighten it up a little bit or loosen it a little bit, any which way, whatever works for you. Because in my approach with treatment, when someone sits there and says, you need to do this, this, and this, that might not work for me. We have to, we always say, meet the person where they're at. Who else knows what they've been through than you yourself? So when somebody comes and says, if you do it this way, you'll succeed. I tend to differ. I believe that, the treatment should be based on your strengths and your weaknesses. Okay, what are your weaknesses and how can we strengthen that? And work on your strengths. How can we look at your strengths to become a better person? So instead of saying, okay, let's write this script, here's your script, this will help you. I always believe that the therapy, the one-on-ones, listening to the person, and learning what they've been through. Some people, and let me talk about me. My approach was I just wanted somebody to listen to me, to let them know what I've been through, and sometimes that's just enough. And it's not about, okay, here's your script and move on. Sometimes that person just needs to vent and let go of the pain that they've been through. And that's what helped me. When I sat down with a therapist and let him know, I miss my dad. I love my dad. My dad was a huge part of my life. How can I live without him today? And I needed to talk about that. So it wasn't until then that I really started to heal. And I just think that's the approach that people need to have.
Yeah, totally agree. When Ramon was talking, I just wanted to mention, sometimes we forget about the basics too, like exercise and getting enough sleep and diet and some of these things that we take for granted. But when they're brought to our attention in therapy, it's like, oh, yeah, I actually really haven't exercised in like 3 months, and like giving those little things a chance can really go a long way with our mental health. And the other thing is, I think it's best to have a team behind you. If you need to see a psychiatrist for medication, then that's what you need. Or at least get assessed and see what they think. Having a psychologist or a counselor, someone there for psychotherapy, talk therapy, and then having peer support or a peer specialist or someone like Ramon that can be with you and give you their experience and offer you different resources. I mean, they're the most crucial people in the whole team. But having a team around you of professionals, it's just kind of imperative. I think it's really essential.
So once you're in this team structure or in a clinical environment, there tends to be, no stigma, no, judgment free. But what about before you get there? What is, the stigma that's associated with substance use disorder and mental health issues? And then if you have co-occurring condition, I'm sure that there's even more stigmatized. So what are your thoughts on the stigma before you get into the clinical space and the team-oriented space?
So when we talk about stigma and substance use disorder, there's a huge part of the stigma where people believe that someone with substance use disorder is someone that looks dirty, sticks a needle in his neck or sticks a needle in his arm, and it's far from that. It's and that's the stigma. But I know people that have substance use disorder that go to work every day, that wear a suit and tie. And that's the discouraging part about it. So in you going to treatment, you already behind all this stigma, and you think they're going to treat me with not empathy, sympathy. And some people just don't understand that. And one of the things that I always tell someone is, I'm just one shot away from being just like you. And people don't need to understand that the roles can be reversed at any time. So when you talk about stigma, that is one of the barriers that people have into getting into treatment. Some people don't want to go into treatment because of the stigma. And I've approached many people and engaged with many people that say, no, I'm okay, because when I got there, I wasn't treated right. And I left, and I think that's huge right now.
Because you both have so graciously and willingly shared your stories with mental health issues and substance use disorder, I'd like to just hear from you what else you want our listeners to hear about dual diagnosis or co-occurring conditions.
Yeah, I mean, above all else, the message I like to convey is one of hope. To do my best to instill hope to any listener or to anyone, that this recovery thing is possible, and in fact, it's actually likely if you do some certain things, accept yourself for who you are a little bit, start to make some changes slowly but surely. This thing is very likely for you. It's so possible, and I know it doesn't feel like that all the time. But if you can take one step forward, one small step at a time, you're on your way. You're on your way. And there's people out here, there's something like 24 million people in America living productive, fulfilling lives in recovery. It's a lot of people. We're out here and we're living fulfilling, meaningful lives. I mean, just hearing Ramon's story today that's the most inspiring thing. Like, that's hope. That is. That can be you. There's nothing special about Ramon and I, really. We were fortunate enough. We made some decisions and some things happened for us, and we were able to recover. And so can anyone. So can you. And that would be my message, a message of hope that it's possible.
How about you, Ramon?
Did I ever think I would recover? No, because I didn't have any hope. I didn't think, and a lot of people need to understand that there's a purpose in your life. Everybody has a purpose in life. I wasn't born and said that I wanted to be an addict. I wasn't. I made bad choices in life. But you know what? I learned a lot. My son is dealing with substance use disorder, and he is living the life that I live every day. I have the opportunity to let him know, listen, it gets better. Just give yourself a chance, and to listen to him where no one was there to listen to me. Today, I'm very fortunate to also have another part of my life where I have my own radio station. and it talks about the stigma in Kensington. So I choose on my radio station to talk about the positive things that come out of Kensington. So in my show, which is called Kensington Post, I bring people on my show that are doing extraordinary things and that are come from Kensington or have gone through Kensington. There's so much resilience in this community, and we continue to fight and strive to get better. And I believe that it will get back to what it used to be, a thriving community.
And I want to thank you both, again, for your participation today and for being a part of our podcast, but also just your engagement and participation in the Someone You Know campaign. It's an honor to know both of you, and I look forward to following your work and celebrating all the great things that are on the horizon for both of you.
Thank you so
Thank
much.
you so much.
If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below.